Thank you for joining this webinar. My name is Ashish Maharaja. I am working as a Director of Operation here at Exxat. For today's webinar, the topic of webinar is Streamlining Institutional Operations using Exxat. We will, before we kick off, just from a administrative point of view, this webinar will be recorded. And I have with me from an Exxat side, Harsha, who is the product manager, and Ami, who is the project manager, who will help me with this webinar. If there are any questions, you can put it on the chat and we'll be responding. And in between, I will be doing some pause around it and have some question answered. There is a this presentation is also available in the document area, which you can use it and download it. So that's more about the logistic part and administrative part of it. So let's get started. I'm excited today to have Michelle Schleich joining from OHSU. So Michelle is with us. She is Exxat, and OHSU has been working about the implementation of Exxat, and today she will help me with some of the use case and help you all with the use case on how the institutional level implementation and how this particular view is helping them in their organization. Okay, so Michelle, let's have a quick introduction on your side, and then we'll start from the main part of it. So Michelle, let me sort of hand over to you so that you can do a quick and a brief introduction.
Perfect. Thank you, Ashish. Good afternoon, everyone, or morning. My name is Michelle Schleich, and I'm the Interim Director for the Office of Learner Placement and Housing at Oregon Health and Science University on the West Coast in Portland, Oregon. I've worked for OHSU for 15 years now, a decade of that time spent in the Provost Office and the President's Office, working in operational and administrative management prior to being appointed to my current position. So thank you for having me, and I look forward to talking with you guys.
Thank you, Michelle. So let's get started on this. First of all, why this institutional level view is required. So let's go into that details first and try to explore on those areas. So as you all are mostly our Exxat customers and the partners, as we have grown from 2008 onwards, the way we have seen the implementation and the engagement with our partner is more a university level. And few of them you might have seen are we have just few of them are here whom we have implemented as an university level, which means that there are 10 programs, 12 programs, or a huge programs with a student base. So as we were going into that direction, we have seen that we have implemented 1,000 plus programs. We are now supporting 60 plus unique disciplines and domains. And now we have around 40 plus institutional level contract, which means there are multiple programs together. As we were going through this change, it was very evident that we need to help all of our partners on all the challenges which they have. And one of the things which we realized was about standardization across the new domains and new disciplines. So for example, if there is an implementation of 10 to 15 program with Exxat, there is an opportunity of having the efficiency done, reducing more administrative efforts. There is a way where we can standardize stuff across the board, and we'll see this as Michelle is going to explain about the standardization where she is trying to implement using Exxat. But those were the challenges and those were the asks which we realized. And to address that, we really felt that we need to have an application or a system which will manage all their contracts. And what are the scopes? Contracts, the compliance, the user access, all those specific things comes into that bucket of standardization. So that said, we created a view which would be on a top of all the programs, and you can have that visibility of how many programs are having which contracts. Can there be an opportunity of standardization? So now you get a view of making things more standardization. Before that, there was no view where you have an isolated programs, maybe a PT or a PA or a nursing working in silos. So this is an opportunity. This is a way we could have some standardization and efficient way of putting this in an operations side. So that is the why behind why this came into the existence and how we can improve it further as we go down. Now, what are the institutional level access? And as I was trying to hint towards, was on more about what are the different things which has been implemented by Exxat, and we are trying to even grow further. But if you see here, there are 5 elements which we have put at an institutional level access or at a broader view. Those are the contract management, site management, compliance management, user management, and then the new one which came out recently is the placement report across program. This is something I really wanted to highlight, that this is a lot of you might be already using it, but this has just released 2 weeks back, and this gives a different perspective, and I will be touching that as we move forward. But this will give you a great opportunity from the interprofessional data side, and how your program as a university or a college or an institution, how you are able to see and visualize that different students are going in, and different disciplines are going into the same hospital system. So these are the 5 elements which we have brought up for you all to have that visibility. So I'm going to go into the details of it as I'm going into each of them. So as I was mentioning earlier, what are these institutional level views which you may have? Those are, the first is the contract and site management. Now, what does it mean? It means that you can have the visibility and the transparency of all your sites and contracts across multiple programs. So if let's say for example, you have 5 programs, PT, OT, PA, nursing, social work, all of them. Now you have a roll-up view where you can see that this particular contract is applicable for PT and OT. This contract is applicable for nursing, PA, correct? And you can see that which particular site or a hospital system you have a contract and what it covers, which different disciplines it covers. So you get that visibility and a reporting where you can do that particular visualization, standardization, and that have a control over how you want to manage your contract and sites. So that's the first piece of this entire view, which is very important and critical for you to see. And most of you would be utilizing it more from a silo, or if you're utilizing this as an institution level, it would be you will be already aware of this. Second is the placement report, which I was mentioning. This is something the new, and I have this is more related to the contract and site because it gives you the visibility of the students, their locations where they have gone for the placements, the details on which what is the duration they have gone for, and which contract are they mapped to. So it gives you a good view of all the placements which has happened across the different program for the locations and different locations. So then you can have you can do a slice and dice of your data and know how those interprofessional education is going on. So you can get a lot of insight from this reports, and I will go into this as we go into the details of each of them. The third thing is about the compliance management. Now, as I was touching earlier, one of the things which we are seeing as we were implementing this institutional level implementation across the programs and the institute, we see that this was an opportunity. A lot of organizations have or institution have taken into consideration, where they standardize the different compliance documents and their rules of how those needs to happen. So you don't have, if there is a flu document, it is a flu document across, if it's a PT or student uploading it or a PA student uploading it, it is going to be a flu document. Now, whether we want to standardize on how that document should be and how it should be reviewed, that is an opportunity we can have. And that standardization helps in more efficiency, because if the rules are same across the different documents, then it will be or across the programs, then it would be more easy for anyone who is reviewing this document. So there have been a lot of traction on this. We have seen that institution have standardized across the board, and it has helped them to in the efficiency. And the last but not the least and important part is the user management. Like it is very important at the dean's level office or whoever is managing this entire, how many administrative people has what access. So making sure that the right access is provided to the right personnel in your organization for Exxat can be available here. So you can have a visibility of what role which person is having. So you can manage and see that how each of the roles contribute, and what is there something a cleanup required, especially movers and levers, correct? If you have few people moving out, just to make sure that the access are accordingly changed, or if they are changing a department, you can manage those access management. And this gives you a broader view of which person has what access. Sometimes you may see that a person may have access to a PT administrative access for PT as well as PA and OT. But if the role changes and they are only responsible for PT, you need to make sure that you remove those access. Now, where you will visualize it, that is the place, this is the place where you will visualize it and make sure that those changes are done. So you are managing your overall user in this particular access. So those are the four elements primarily, if I will say, contracts, site, placement, compliance, and user management. So let me see if there are any questions, Ami or Harsha, from your side, or anything coming up.
I'm just checking. I don't see any questions, Ashish, as of right now.
Sure. Okay. So that was about the why and the what behind this access and the management. Now let's go into how are you going to do the actual work on this. How will you access it, what it looks like, and the details of it. So whenever you are managing more programs or have this institutional level access required, what we have done is we have created a separate entry point, which is which may be available to you if you are already using it. And if not, there would be a separate access which would be available. And here I'm showing you the screenshot, which provides you a quick view of what's the overall access level. So here, this is a screen, this is a menu. You click on it, you can go into the management of each of this particular tile which I was explaining. So user management, compliance, contract, and site. So that is how the entry point is. There is a different view. Whoever you need to provide, that is how you can manage this particular view itself. So that was more from a overall access point of view. Now let's go into the sites and the contract. So who will be more benefited to have this access of contract and site management? What we have seen is whoever mostly what we see as we have been implementing all this university level contracts and the implementation, if there is a central team who is responsible for managing all the contract, that is an ideal team to have this access, because they are managing all this contract across the board. So that way it adds value to their operational efficiency. and whoever is reviewing or overseeing, and a central team who is overseeing contract and sites, that team or individual would be ideal to have those access, and even dean's office to have a good view of the end-to-end of contract. That is the team ideally would be benefited from this. If it's a one program, it does not make sense because it's already there with you. But if you have a more program and a central team, it basically helps. And as I was mentioning earlier, it will give you a good centralized view and a dashboard to see how the different contracts are there. You can manage, add the contracts, assign it to the specific programs, and edit the contracts in the site. So this way you are able to control it from top down sort of approach. Yeah. I'm just showcasing few screenshots just from a perspective of how it will look like, and more from a perspective of this screenshot gives you a dashboard of how the contract is. So the way we have created is a dashboard which gives up how many are fully executed contract, how many. It gives you a quick view of what is the state of all your contracts here, and it gives you a quick snapshot on what is the overall trend of how you have been managing contract across, how many number of contracts have been initiated every year. So you can see some trends around it. What we have seen is obviously the growth trend of as we go from 2022 2023 and onwards, a growth trend you can see from your side how things have been there. So it gives you a perspective, a quick bird eye view on how things are going with your contracts here. Same way, this is a list, a quick report would be, or a list view or table view would be available for you. You can click on each of the contracts, edit it, add the contracts, all those functions can be done, filter it. So you can play around all of that and have the right information available to you from this piece itself. To remember it, as I was mentioning, this is the program covered part. You can quickly see that this particular contract is covering PT and OT program both. So you can have those analysis and understanding here also, and you can even see whether there a specific contract has expired or is expiring, and all the details can be available for you. As I was mentioning, you can do a lot of things with your filter and get the right information. Like if you have a site which has not been associated with a contract, you can see that, manage those different filter of expiration status, different programs, in the sense I only want to look into all the PT related contracts or a PA or a nursing contract. So that is the way you can then filter and visualize this contracts. Same way for the sites. When I say sites, and most of our partners here are already aware, sites is a hospital system with which we do the contract entity. So these are all the sites which would be visible to you. You can add a new site and assign the programs to that, which means that, okay, this ability center is with OT, nutrition, and PT, for example, here. So now you can manage that site, and automatically those programs who are using it would start seeing this site on their side itself. So you are simply managing it and adding this, and it would quickly have that visibility on each of those programs wherever you assign those programs to. So you manage it, it trickles down into all of those programs, and they start seeing all those sites into that. So this was more about the sites and the contract management, and we will be going into the details about how, if you don't have the access, we'll work out on how you can get it. That's something coming up in the slides later. Let me pause here if you have any specific question on contracts and sites.
We are checking the questions.
No problem.
We don't see any questions as of right now.
Sure. Okay, let's start with this placement report. Now, from a placement report perspective, as I was mentioning, this is one of the feature which got live last week itself. I think this is one of the asks which we have seen from so many of our partners, that we need a consolidated placement reports, and one of our partner is with us, OHSU, who has been looking for the placement reports as a consolidated view. So they this gives you a centralized view of all the placement which has happened for all the programs, all the cohorts across the time period. It gives it is a super valuable report if you see from an interprofessional education side, because as you see all the programs for their accreditations and more from a WHO also, they are trying to highlight that as a whole, as a overall students education, they emphasize on the effective teamwork across the different discipline. A PT program working with public health as well as a PA for students, give a perspective to each of the students on how to work with different disciplines as they go into the actual hospital system and work. This is one of the experience which will be very beneficial, but how you will know whether they are getting it, and that is why we want this placement reports to be available to you, where you can have those longitudinal and latitudinal view, which gives you that how the students are being placed across the sites and across the locations, and that is where you can provide those details. So this is a data very important, and I wanted to emphasize it because it came just a week back, and this is one of the very good report which you will appreciate. The other, just from a visual point of view, this is when you log into this app, institutional level view, there is a placement report tab which you will see on the right hand side of the tile, and it gives you this particular report and in an exportable way itself. So the details about the students, their location address, which setting, what was the rotation, the duration, and the details, and then you can even see and combine how many which program you want to see the reports for. So it gives you a great way of seeing all the reports together, and this is an extract which you will see from the Excel exports as you do that Excel export. Okay. Any other questions on placement reports?
There's not a question on placement report, Ashish, but I do see one question on the locations.
Yes.
Can we see all the locations across the program in institutional app?
Not yet, and I will say not yet because we are strongly working on seeing if we can bring up the location view to the at this level, and I think we have a lot of ask on a similar from a different university partners and our partners on this ask. So we are definitely already reviewing this, and so as of now it is not there, but yes, we are working on seeing how we can provide that visibility. So that's something you will hear from us on this side soon on this on the plan for this item. Any other question, Nami?
No, Ashish, that was the only question that I saw.
Okay, good. Let me go to the compliance management part of it. More from a compliance management here, as I was mentioning, it's about standardizing the different compliance documents. It may be a FLU or an MMR, and how you can have a centralized team. What is the applicability of this? We have seen a lot of schools and institutions and university have one central team who is responsible for overseeing all the compliance. Now, this view gives them a very specific clarity and a 360 view about all the documents. Like, for example, I want to know FLU as a document or a compliance document which are all the students who have not yet uploaded or they are not up to date with flu vaccine. So you can get all across the program now, correct? So you can see that there are 10 students who are not compliant with flu, and 3 are from PT, 2 are from PA, 4 are from nursing and stuff like that. You can even see that from PA how many are not there. So you can slice and dice the data based on your compliance document, like I was mentioning about flu, or you can do it on a reverse way of seeing that I want to see about PT compliance. So that way it gives you a visibility of all the programs by the documents, by the status, and you can see that. So this is a really powerful view, and the reporting and the management you can do with this particular app. Just to give a quick snapshot, this is what it looks like when you see it. All the students, all the programs are listed. What is the name of the documents? What is the status? Everything would be visible. And this is going to be much more easier if the standardization is there, correct? Otherwise, somebody will be having a different way of writing, somebody having a different rule of approving a flu document. That is going to really be not efficient. So this is an opportunity where the standardization can happen, and you can manage all your documents of your students accordingly. You can even do an approval and set up and make sure that everything is proper here itself. So this is a classic example for the compliance office who is managing centrally all the compliance documents. So that's how you manage the compliance part of it. I will go into the last one about the user management. User management, as of now, as a fourth item, which is because we are still need to do an update on this. Now, what is there as of now? As of now, you can see all the administrative staff who has what access. So it gives you a visibility. There are 50 people who is accessing Exxat, and what type of access do they have? Are they having a couple of program access, or they are only having a specific program access? And in that specific program, what role do they have? So that is how you will be able to see at the moment. Now this will help you, as I was mentioning, about movers and levers and making sure that you have a right access to the right people. So that way you can manage all your user management across the board. And as of now, it is the view only, which means that you are not able to change the access or delete that user. But this is going to come, where you will be able to manage the user and edit their access. But it's, as of now, it is a view only. We are working on getting this more better from a feature rich perspective, where you can even manage that user management on your, instead of reaching out to our support team. So that's on more about the user management, where you will be able to see, like for example, in this screenshot, a particular administrative staff have 4 roles associated, and they are part of the nursing program, and they also have the this particular access already available. You can, if you click on that 4 access, you will be able to see what roles they have been assigned to. Same way, you can see by role, like who has all the full access. There are 13 people, 13 personnel who are having full access to the administrative, and you can see that who are those people, what are the programs they are for, and when they have last login. And this is something which will help in providing you a perspective of an engagement also, that is there engagement going on, is there somebody logging in, if you want to manage from that perspective, that whether the Exxat system is being used by your program efficiently or not. So this is one parameter you can see from a last login perspective. You can even see who has what access and which particular individual. So that way it gives you that visibility of user management. So let's go into the details about, if you already have an access and few of the access are missing, you can accordingly raise a request. But just wanted to make sure that this gives you a full view of all the programs. So I want to just be cautious on providing the access to the right individual, because it gives you all the access of all the contracts and sites, all the compliance document across the board. So when you are asking for the access, just from a perspective of the right access, from a FERPA, from a HIPAA perspective, what your role is, you can accordingly ask for that access, and we'll be accordingly provide you that access. So you can work with your account manager who will be there, and understand what access is applicable for you and work with you. So that's how you can manage this access if you don't have any of them. Okay, so it's already half time here. What I wanted to do in this webinar was I provided you all the visibility of why we had this, what are the different views available, how to use these views, and where it is applicable. Now I want to transition this to the use case. When I say use case, Michelle is there with us, and she will be able to provide us how she has been utilizing contract and site management for OHSU and what are the different benefits. But before I go there, any question from a feature side or anything till now?
There are no questions, Ashish. Some of them we have been answering via the chat. So,
okay, excellent. Thank you. Okay, Michelle, over to you, and you can kick off. I will go to the next slide, but yeah, over to you, and you can start on that.
Can you hear me now?
Yes.
So thank you very much for letting me join this webinar. I did want to give kind of the why, as OHSU has partnered with Exxat, and then yeah, I'm more than happy to answer any questions that anybody has. I really appreciate this opportunity. So as part of OHSU's 2025 strategic plan, our organization prioritized Objective 2.1, which was focused on learner placement, to support the needs of our expanding number of students and to meet our current graduation requirements. The institutional recognized that we must address projected shortcomings in all of our learner placement experiences for all of our programs. And for years, long-standing decision-making processes and a lack of communication across our missions had led to a lot of confusion and uneven utilization of internal and external resources. And unfortunately, the pandemic only made this worse. So in May of 2021, the Office of Learner Placement and Housing was created, and we were charged with developing a centralized, coordinated, and equitable system across our 5 schools and over 55 programs. So this clinical placement management system would allow OHSU to increase educational standards, improve the quality of our learning experiences, again, like Ashish said, foster interprofessional education, and enhance patient safety and optimize satisfaction for our learners, our preceptors, and our faculty. And lucky for OHSU, I enjoy a challenge, so I was appointed as Interim Director. Through months of stakeholder interviews, gathering all of our functional and non-functional specs, establishing work groups to comb through the data, and to identify a clear set of requirements that would best fit the needs of all of our programs here at OHSU, we issued a formal RFP in March of 2022. And since I'm here talking with this group today, it's safe to assume that which vendor was awarded the contract. So beyond just meeting the functional requirements of a learner placement system, Exxat was able to meet one very important requirement that I think OHSU prioritizes above the rest, and it was to become a longstanding partner of the university. So implementing change across an organization as large and as complex as OHSU takes a lot of trust, experience, and knowledgeable leaders who understand the goal of the institution at the macro level, to work on developing standardized and efficient processes that we could then push down to the micro levels in order to move the bar of the learner placement system and address our institutional needs as a whole. So next slide. So there are many benefits of implementing a centralized clinical placement system, but the one benefit that each and every program could really rally around was the ability to pull transparent and real-time data. For programs who may have previously tracked all of their placements through Excel or even a Word doc, as we have seen, or have experienced the delays of not receiving answers to critical questions regarding a student placement because the clinical coordinator was sick and the document that they stored all the information on was on their local C drive. Having that ability to log in through our OHSU single sign-on and gather the information to make these critical changes to placements or even pull reports was a milestone for all of our programs. Next slide. For the Office of Learner Placement and Housing, Exxat has implemented the University Tenant Level app. So this module provides my office, the Office of Learner Placement and Housing, with the ability to centrally manage and standardize all of the shared resources across all of our programs. So OHSU currently has over 1,600 education affiliation agreements. Some are very program specific, while the majority that we negotiate at that central level are universal and apply to all, if not, well, most, if not all of our programs that wish to use a site or a healthcare system. So prior to implementation of Exxat, OHSU used a program called Prodigo, which programs didn't have access to. So they were not able to see any of the sites OHSU had developed relationships with, or even if a site had an active contract that was on file. They had to call up our contract service group. They had to, ask to see. The contract service group would have to then delve in, and they might have entered it incorrectly. So there wasn't a great way to transparently see that information. And the program's only knowledge was in regards to the relationships that they had personally developed. So providing this access to all the programs and providing the program filter, if they can remove that program filter and then see all of the active sites and contracts, this has provided our programs with more opportunity to build upon current relationships and understand potential conflicts across disciplines with competing placements. It also has provided an opportunity to engage with these sites as one organization rather than siloed entities and work together to build out our relationships and our preceptor networks. So next slide. Thank you. The University Tenant app also provided OLPH with the ability to pull comprehensive placement reports across all of our programs. The ability to actually pull these data-driven reports has provided my office with the ability to monitor and proactively address program-specific needs in order to have a better understanding of the impacts across all of our programs. We have so many programs that compete for current placement sites that we are now able to, as a whole, and have all of the stakeholders at the table and talk about these issues together to develop, different ways of thinking about placements and working together as one university rather than these programmatic silos. So as we develop and build out more strategies over time through Exxat Prism, and then soon through Exxat One, which I'm excited about, this tenant level app will provide OHSU with the ability to understand true capacity in our own health system and develop more of a systematic way to ensure that we're meeting the needs of all of our programs and utilizing all of our available placement opportunities here at OHSU. So the road to implementing a centralized learner placement solution across 5 of our schools and all of our programs is going to take time. And it's, as with anything, it's littered with hidden potholes that come up when you least expect it. But change is never easy. And I believe it was Abraham Maslow, a highly accredited psychologist who created the Maslow's hierarchy of need, who stated, in any given moment, we have 2 options: to step forward and grow, or to step back into safety. And I think OHSU, like many of the other of the higher education institutions, can't afford to step backwards. Our goal, our objective, our purpose is to educate the next generation of healthcare professionals, scientists, engineers, and managers in top-tier programs to prepare them for a lifetime of learning, leadership, and contribution. we all have come to that pinnacle point where in order to become more efficient and effective leaders, we must adapt and we must grow and improve our processes. So I think that's why OHSU is really proud to be partnering with Exxat on this journey. And we're excited to be part of a community where institutions come together to not only share use cases like ours, but develop a rapport where questions are asked and best practices are shared across organizations to prepare and improve the system as a whole. So thank you very much for joining the webinar today and letting me speak. And I appreciate the opportunity to just share our stories and would love to answer any questions that you have in regards to OHSU and how we are utilizing this centralized university tenant level system.
Thank you, Michelle. Any questions you have? Anyone you can see, Ami, from anyone from our partners?
No, Ashish, I don't see any questions.
Oh, while we have few minutes, what I'm going to ask you questions because that is where we can start from, and I will going to ask to Michelle. So Michelle, I know I want to have this conversation more from a sharing point of view with other people who are joining here, but few things from best practices when we discuss with Michelle. The main point was what are the best practices which Exxat has. Now Exxat, from a perspective of working with so many programs, it is one of the things which we always discuss in each call with Michelle. And same way from Michelle's side, a lot of ideas comes into play and we sort of implement in our product improvement. Now one of them was, and which you all might be using it, was contract generation process. Now in Exxat, in this app itself, we have, what Michelle has done is, and Michelle, I will let you explain, but the contract generation and that template part, if you want to just highlight for a couple of minutes on how it helps.
Definitely.
Yeah.
So one of the things that Exxat has really helped OHSU on is, prior to implementing kind of a centralized way of generating our contracts, is we used to have Word docs on our internal O2 site where programs would download. So there was no control. There was no way of ensuring that that was the latest contract to be used. People would have, download it 1 year and not continually update or download the newer versions of things. So version control was very important. We now have a centralized, centralized system of requesting contracts. So now all of the contracts requests, they come through our office. We're able to create the site in Exxat. We're able to then generate the contract and follow all of the routing workflows. So we've really are utilizing the system so the programs have a way to see real time, where are we at with this contract? Is it in development? Have we sent it off to the site for signature? Is it still in discussions with our risk management department and our legal? So this is something that we are utilizing Exxat as a way to provide our programs with updated information. And then once something is executed, it's updated into the system. The programs are then notified, and we add all of the information to, we add their program to the site, so then they have access to it, and then they can start the relationship building. So that is something that, prior to Exxat utilizing Prodigo, again, that was an outside system where no one had access to it, only our contract services department. And this way, people are well informed of the process. They know where the contract is at in the negotiation process. And yeah, then they also have access to all of the contracts that were superseded by this newer contract, and it's tracked in their placement reports now.
Yeah. And just to give you a perspective of what Michelle was trying to highlight is, for a particular site, if you have a contract, you can also create this version which would be available to all the respective programs, like for example PT and OT. But at the same time, what Michelle has developed is she has created a template for on their side, and which basically would help in generating the contract itself, like creating it. Because if you see, there are a lot of details which are going to be common if you are using the university templates. It's all same. The things which can be different is what is the location, who are the point person, when was this contract started, ended, and all these things can be accordingly created as a template, and a generation of those contract can happen within a click. So that is also one of the feature which is being used by Michelle in her organization for generating that contract across the board. So this is what she was trying to highlight about the contracts being at one place and how she has been generating the contracts with the template itself. So if you are not having this, you can let us know, the support team. You can provide the template. We can generate those template for you. There are a few points which would be there, like for example, as I was highlighting, or she was highlighting about the template generation. This is all same, but the things which are different are going to be few details which needs to be there, and we can generate those detail for you based on the information we already have. So that's the part about the contract generation. But any other questions from anyone else?
Yeah, I see a hand raised. I will go ahead and unmute you, Andrea. Yeah, you can go ahead now.
Hi, Andrea.
Great. Can you hear me now?
Yes.
Yeah. Awesome. I was just wondering, Michelle, how did you determine, based on the tree structure that she showed earlier, who were going to be the people ultimately managing all the different contracts and having access and views to that?
Definitely. So for OHSU specifically, because we've developed the Office of Learner Placement and Housing, we are neutral outside of all of the programs. So we report up to the provost office. And so the tenant level app, we are monitoring as part of our OHSU 2025 objective. So we're the ones, OHSU as a whole decided that the Office of Learner Placement and Housing would be the ones responsible for all of the reports for all of the shared resources. So that included site negotiation, site development. So really trying to develop the relationships as an organization rather than our School of Medicine going out and negotiating contracts, or then our School of Nursing, coming 2 days later and saying, hi, we'd love to work with your organization. And the organization saying, wait, we just worked with your organization 2 days ago. So there was a lot of, again, breaking down these silos. And so the Office of Learner Placement and Housing, we work with all of the schools and all of the programs, so their needs are heard. And we're looking at, what affects one program and one school is also affecting another program and another school. And so it's coming together to find strategies and work towards really breaking down these silos. And so our office manages then all of the contracts, making sure all of the sites are entered in, that programs have questions in regards to what relationships do we currently have in the works, we're able to then help them understand that, hey, we have all of this relationship over in the eastern region. We also have housing associated there. So one of the things for OHSU is we offer housing for all of our students who are going out on clinical rotations 40 miles outside of the Portland metro area where OHSU is centrally located. And so again, we have contracts that are a shared resource, housing that's a shared resource, developing relationships with sites. We're in charge of that as well. So yeah, we're trying to funnel it into all of the central resources being managed by our office, and then helping to kind of share those details and spread, the knowledge of what we can do to help support those programs. Hopefully that helped.
Thanks.
There is one more
And
and or a question from Katie, I guess, Ami. So
I'll go ahead and unmute Katie. Katie, you may speak now.
What exactly is Exxat One?
Did you hear that, Ashish? What exactly is Exxat One?
Yes. Good that you ask. Exxat One is a platform. So the Prism platform, which we are showcasing now. This is a Prism platform which is for all our university partners, college partner, institutional partners, who will be using this Prism platform for doing the clinical management. But our Exxat One platform is more about to be used by the hospital system. So why Michelle was trying to highlight, because OHSU also has a hospital system where they basically take a lot of students from internally from OHSU as well as the external students from different other universities. So what we are trying to and this is one thing which has been a lot of information is provided, and I can share it with you, Katie. But this is the product for the site, and we are also providing that connection from a Prism point of view, where you can request for the availability to that hospital system. So we have partner as of now with 10 plus hospital system, and specifically for a PT program, they had the March 1 go live happened where they do a availability request. So we had around 10 plus hospital system where we partner, where they will be providing the availability on what are the different availabilities there for different location, and each university partner can log in and ask for that I need 5 students in this location, and then the hospital system can provide that, okay, I can provide you 2 to university A versus university B 3 based on however they want to provide. So that gives you a platform which engages both university and the hospital system together. So that's what she was talking about, because from OHSU side, they are also going to utilize the site part of it also, so because they have a hospital system. But Michelle, if you want to add, you can add on that.
Well,
yeah,
I'm not there yet.
Yeah.
We're still
Just
trying
starting.
to understand how this is all going to work. But OHSU is Oregon's only academic healthcare system, and so one of the things that we struggled with is actually understanding internal capacity. So how many clinical placement practicum slots can we offer? And so being able to really understand internal capacity, understanding our program's needs, being able then to say, here's our capacity, here's how we're going to fit our needs for our internal placement opportunities, and based upon that, then we could then offer more slots to external organizations. And so having a way to really understand and have the data in regards to what we can offer, what our needs truly are. It's a solution that OHSU desperately needs. So
it's like a supply demand from a perspective, and OHSU being at a specific place where they have a hospital system, also they have the university where the programs are. So basically supply demand, how much are the demand within internal OHSU itself, and that is what that first visibility transparency. So that's what. So Katie, I hope we answered your question.
Yes, thank you both.
Okay, anyone else? Any other questions? All good? Okay, I guess we are on time. We have 4 minutes left, but I hope this webinar was informative. And thanks, Michelle, for being partnering on this and presenting along with me. We will send you all the details, all the presentations, and everything. So tune in for that email follow-up. But thanks for your participation, everyone. We'll look forward.
Yes, thank you all very much. And you know, again, like I mentioned, I really appreciate having the opportunity to come together and share best practices. But if anybody ever has any questions that are here, you can email olph@ohsu.edu, and I would love to, be a resource for you. So
Thank you, Michelle. Appreciate that.
thank you.
Okay, have a good one, everyone, and we'll talk later then. Bye.